Two common words you hear in nursing education and nursing practice are the terms research and evidence-based practice. And sometimes you might think, okay, well, those things, I hear them all the time. They must be exactly the same thing. But that's not true. They are very much related, but research and evidence-based practice are not the same thing. Therefore, this video is going to present some information to help you better understand what research is, what evidence-based practice is, and how they're similar and how they're different. So first of all, what is actually nursing research? Research broadly is a systematic inquiry or way of studying something using disciplined methods to answer questions and solve problems. And notice that I bolded the word systematic a couple of times on this slide. That's important because any kind of research that we choose to do has to be very systematic and disciplined. So we're not just going to get on a search engine like Bing or Google and do some random searches and say, okay, I research something. However, as a student, don't we do that all the time? And I'm very guilty of this too. I'm just going to say, well, I researched that and I found out that. But what I really mean is I just got online and did a quick search and found a few articles or random websites. That is not research. It's not systematic, nor is it disciplined. It's not well thought out in advance. So that's not research. So just, when all those hours of research you thought you were doing, not so much. What nursing research is the same thing, but our purpose is to develop evidence about issues and problems that are important to both nurses and the clients that nurses care for. So the focus of nursing research can be in many different areas. Obviously, patient care and client outcomes are an important cornerstone of nursing research. However, we also do research within the realm of nursing in educational practices. So how do we educate nurses or nursing students better to have better outcomes later on down the line? Other ways, we look at nursing administration or nursing management. So there's research out there about how to be a better nurse manager so that your staff have better outcomes. And then down the line, your patients have better outcomes. So those are just a few of the ways that research can be done within the umbrella of nursing research. And then lastly, clinical nursing research is that first example that I just covered. It's all about improving our patients. We want to improve the health and the quality of life for our clients that we care for. And that's across the lifespan. That's any kind of specialty that's out there in nursing. It's very broad, but if we're specifically impacting the outcomes of our clients, no matter where they lie on the continuum of from development, is clinical nursing research. So similar to that, but not the same thing, is evidence-based practice or EBP. And that is a huge buzzword, and it has been for decades, for a few decades now. And I know you've heard evidence-based practice, and you think, oh yeah, I'm using evidence-based practice every day. I'm turning my patients every 2 hours. I'm doing proper oral care to prevent ventilator-associated pneumonia. I'm doing that. But what it specifically is it's using the best available evidence out there and helping us, the nurse, to make the best patient care decisions possible. So inherent in that definition is the fact that you have to know, as the nurse, what the actual research literature says. What does the evidence say? If you haven't actually dived into and read the research literature, then are you really practicing evidence-based practice? Are you just doing what your policy and procedure manual says or what your leader or administrator says? Yeah, you're probably not really doing evidence-based practice. Um, but obviously, and we know this, we want the best outcomes possible for our clients or patients, whichever term you prefer to use. That's why we're in this field. We're not in here just to do a haphazard job. We really want to make a difference in the outcomes and the lives and the quality of life in our clients that we care for. So we have to understand why we're doing what we're doing on the front lines every day with our patients. We have to understand those clinical practice changes are stemming from what the research says. Okay. And inherent in evidence-based practice is that the things that we're doing should definitely, of course, be appropriate clinically. They should be cost effective, and it all boils down to better patient outcomes. So you'll see on this slide that evidence-based practice is not just let's read some research and let's use it. So I have separated best evidence out here by itself because that is a fundamental part of evidence-based practice, the evidence. Otherwise, you just have practice. So we have to have the evidence. The evidence can look like a bunch of different things. It can actually be our own clinical expertise, which is here. It can be tradition or authorities, such as what does your nursing specialty organization say in their position statement or in their clinical practice guidelines? That is a type of evidence. Obviously, research studies are a type of evidence. So when you say the word research and you think about reading those horrible journal articles that you don't always understand and they're full of statistical jargon, yeah, that's research. That fits under best evidence, but you see that that's only one piece of the pie. We can't just go out and read study articles and decide, okay, that's what I'm doing. I'm going to do this in my practice. Because guess what? It doesn't always work. And we know that based on our clinical expertise. If you've been a nurse for any length of time, you know that sometimes there's what we call flavor of the month. So we're going to try this new policy. We're going to do this new initiative, and it works for a month, it works for 2 months, and then, man, we quit doing it because it's not effective or it's not efficient. You know, as a nurse, your practice, what works and what doesn't. You've seen it. That needs to be a part of evidence-based practice. You can't totally neglect what the evidence says, but you need to marry those two together. You need to use your experiences and your expertise paired with the best evidence. And the final piece, which is what does your patient want? Because clearly we need to be giving client-centered care. So we can't just go in there and force our wills upon patients. That's not patient-centered care. So what does your client or your patient want? What do they value? What do they need their healthcare experience to look like? And when we put all three of those things together, that is what evidence-based practice is. And it helps us guide our clinical decision making on what we're going to do. What are our policy and procedure manuals going to look like? How are we going to practice? So again, a key ingredient that I separated out on that previous slide is best evidence. That means you have to actually be able to find evidence, which means you need to learn how to search through library databases, not Google or Bing or any other web browser or search engine, but library research databases. You also have to emphasize integrating that evidence with other factors, namely what does your patient want and what is your clinical expertise say. So this is my last slide, and basically I'm going to use it to kind of compare and contrast evidence-based practice on the left and the research process on the right. And we're going to think of the research process as the scientific method or a traditional quantitative study. However, please know that's not the only kind of research, nor is it the only kind of valuable research. Sometimes the problems that we encounter as nurses need to be solved or answered by qualitative research or critical theory research or various other types of research. But for the purposes of comparing and contrasting, I just picked a traditional quantitative or scientific methody kind of study to show you. So first of all, what I find very interesting is step one of both evidence-based practice and the research process both start with asking a question to try to solve some problem of importance in your practice. So whether that be you have an increase in patient falls in your department, or an increase in the number of central line associated bloodstream infections, or you have a high number of nurses who are leaving the practice and turning over or being burnt out. Those are all problems that are very important to us as nurses and to our patients. So we use those problems to define a question that we want to find the answer to. And then basically we go through all of the other steps in both research and EBP to find the answer to that question. Now, what's unique here, which I really love, is this whole process of step zero. And you think, okay, basically the foundation of anything to do with evidence-based practice is to have a spirit of inquiry. It's a questioning mind. Why are we doing it this way? Is this the best policy that we should be following? Would other procedures lead to better patient outcomes? Or would my patients be happier if we did this procedure a different way? Could this be done more cost effectively and more efficiently with better outcomes? That questioning nature should be inherent for us as nurses. We're drilled from the very beginning of nursing school to assess, assess, assess. So while we're assessing our practice, we should be assessing what questions do we have about our practice. That's where the spirit of inquiry comes, and that's from where the questions that you would ask would derive from your practice and problems that you face and questions that you have. So I'm going to kind of walk through very quickly these steps to evidence-based practice just to kind of really just broad level show you. And then we'll talk about research very broad level so you can see that they're not the same. So we started off with a spirit of inquiry. We've asked a question that we would like the answer to so that we could have better patient outcomes. Then the only way we're going to find the answer to that question within evidence-based practice is to search for the best evidence possible. So we're going to do a systematic search where we plan out our keywords and we look in the databases like EBSCO, CINAHL, PubMed, Medline, those types of things, Embase, excuse me, to find answers to the question. And a lot of times you'll hear the word PICO, PICO, as a way that we format questions for evidence-based practice. And there I have other videos about how to create an evidence-based practice question. So that's not the purpose of this video. So we have a question, we've conducted a literature search, a very specific search to find evidence to answer that question. Once we have the evidence that specifically deals with the question we've asked, then we have to read it and appraise it. And a critical appraisal is basically a broad level critique of each study to see, is it rigorous? Is it has it taken all approaches to minimize bias? Or is it a good sample size? Is it specifically the intervention and outcome we're looking at? You're evaluating them. And then we synthesize the evidence together. So rather than looking at 10 different studies, we put the findings and facts from all 10 studies together to give us a single body of literature to answer our question. So what does those 10 articles say? What is the answer to our question? Okay, and so that we will then take that, what the evidence says, and marry it together with our own clinical expertise and our patient's preferences. Remember, it's not just the evidence, there's other pieces to that, and we will determine what we need to actually put into practice in our workplace. Okay, once we've done that, once we've made the changes in policies and processes, we'll collect data to evaluate if we actually met our outcome. And then, of course, we need to disseminate our findings or outcomes. So we need to tell other nurses what worked and sometimes what didn't work so that they can use that to inform their practice. It's not always going to be good outcomes, but even the bad outcomes from EBP processes, we need to let others know about so that they don't waste time doing things that don't work. So the flip side of that, of course, the research process. This process is about creating evidence that does not exist right now. So you see here for evidence-based practice, there's already evidence out there. That's why we did step 2. We searched the literature. We found studies that have already been done to answer the question that we have in our practice. But in research, the question that we asked, there's no evidence for. There may be one random study out there, but that's not enough to base practice on. So we need to develop new knowledge, and that's what the research process is about, is answering a question with newly generated knowledge that's not already floating around out there in the library database somewhere. So we're going to ask a question, we're still going to search for literature because we don't want to go through this whole process if others have already definitively answered our question. So we're going to read the relevant literature surrounding our question. We're going to perhaps realize that there's not enough evidence out there to answer our question. So we can't do the EBP process. We actually have to go through the research process. We will define a conceptual framework that will guide our study, that tells us what kind of design we should use, what kinds of data we're going to need to collect. Then we're going to develop our purpose statement or our objective, hypotheses that we want to test, what kind of information do we need to collect, and how are we going to do that, and what kinds of people are we going to sample and study. Again, this is broad level. This is so much. This step 4 is a massive undertaking. So please, the quickness that I'm going through this does not demonstrate the how long this takes. Then you're going to collect data and you're going to test your hypotheses to answer your research questions by actually doing your study. So it can be an experiment. If you're trying something out for the first time, it could be a pilot study, which is just a really small scale version of what you want to do, but you want to do it with maybe a small group of people to decide if it works before you roll it out to a bigger group of people. Then as you collect your data, you're going to analyze it statistically if this is quantitative, which this is, and then you're going to come to conclusions. What does the answer to your question say? So how did the data you collected from the sample of participants answer the question that you had? And then the last step is the same as EBP. You're going to communicate or disseminate your study findings. So you can see there are some similarities. There's definitely some differences as well. Both start with a question, both do usually have some sort of literature review, and both are going to communicate their findings. That last step is important because if we all are doing our own little individual things in silos and we're not telling other people in our discipline what we're doing, then we can't grow our body of knowledge. So dissemination of evidence is super, super important. But with evidence-based practice, we're not sampling people. So we're not going to go out and find samples of people and give them a questionnaire and ask them questions. What we're instead doing is we're going to the published literature that's already out there and we're reading it and we're critically appraising it. Is it a good high quality study? Should I base my patient outcomes on this study? Is it worthy of that? And then once we do that, we put it all together into a synthesized answer to the question that we had, and then we put it into practice and evaluate. Whereas the research process is developing new knowledge that's not already published out there to answer questions for which we don't have answers yet. So they're very different, but they also have some similarities. So now I hope when you hear the word research or the phrase evidence-based practice, you have a better idea of what we're talking about. Thanks for listening.